Welcome to the Bioscan Hub channel. And hey, if you like what you see, don't forget to subscribe to support us. So let's get right into it. We're diving deep into the microscopic world of leukemia diagnosis. Picture this. A patient's results come in and their white blood cell count is, well, it's off the charts. You know something is wrong, but what exactly? How do you go from that one alarming number to a precise diagnosis that could actually save their life? Well, the answer lies in a set of classic but incredibly powerful tools, special cytochemical stains. We're going to explore how these stains help us solve this critical diagnostic puzzle.
All right, here's our roadmap for today. First, we'll tackle the diagnostic puzzle itself. What are we up against? Then we'll introduce our key players, the cytochemical stains. After that, we'll see how they help us make that first crucial split between myeloid and lymphoid leukemias. From there, we'll get even more specific, zeroing in on particular types. We'll even look at a classic case of mistaken identity in the lab. And finally, we'll wrap it all up and assemble your complete diagnostic toolkit. Sound up? Let's go.
So, that lab report lands on your desk. The white count is sky high. Leukemia is, of course, the first thought. But that's just the beginning of the story. The real question, the one that everything else hinges on, is what kind of leukemia are we looking at? Is it acute? Chronic? Is it myeloid? Or is it lymphoid? Getting this right isn't just academic. It changes everything about the patient's treatment and their prognosis.
This is exactly where we have to become detectives. You see, it's not enough to just count the cells. We have to figure out their origin story. Are these rogue cells from the myeloid lineage, the family that gives us our frontline soldiers like neutrophils and monocytes? Or are they from the lymphoid lineage, the master strategists of our immune system, the T and B cells? A simple count just won't cut it. We've got to dig deeper, right into the chemistry of the cells themselves to find the clues we're looking for.
And this brings us to our secret weapons, special cytochemical stains. You can think of them as these tiny molecular spies. They're not just random dyes. No, they are specifically designed to react with certain chemicals inside the cells, forcing them to reveal their secrets. These reactions create these brilliant, vibrant colors that basically act like little signposts, pointing us directly to the right diagnosis.
So, how does this actually work? Well, it's a bit like a lock and key system. Each stain is a unique key that's designed to fit a very specific lock. Maybe it's an enzyme or a lipid or a type of sugar that's hidden inside the cell. When that key finds its lock, boom! A chemical reaction happens and we get this burst of color. It's that color that tells us exactly what's inside that cell, and that, in turn, tells us what kind of cell it is.
This right here is the perfect way to think about it. A diagnostic toolkit. You know, just like a mechanic wouldn't use a hammer to change a tire, we have a whole set of specialized stains. And we're about to learn which tool to pull out of the box for each specific diagnostic job. Every stain is going to unlock another piece of the puzzle, getting us closer and closer to that final critical answer.
Okay, let's pop open that toolkit. The very first decision we have to make is a big one. It's the major fork in the road that decides everything else. Is this leukemia myeloid or lymphoid? This is probably the most important distinction we'll make, and thankfully we have two really powerful stains to help us figure it out. First up to bat is Sudan Black B, or SBB for short. Now this stain absolutely loves fat. It's drawn to lipids and phospholipids like a magnet. And as it turns out, the granules inside myeloid cells are just packed with this stuff. So when we use the SBB stain, it makes a beeline for those myeloid cells and dyes them this really deep, intense black. It's a beautifully simple and really effective way to make them stand out.
And just look at this table. The results couldn't be clearer. The myeloid cells, from the young myeloblasts all the way to mature granulocytes, they all light up, well, they darken with SBB. But the lymphoid cells and megakaryocytes, nothing. They stay completely negative. It's literally a black and white difference. So if you're looking through the microscope and you see a field of blast cells stained black, you can be very, very confident you're looking at a myelogenous leukemia like AML.
All right, let's switch gears and grab our second tool, the periodic acid Schiff stain, or PAS. So if SBB is our fat detector, think of PAS as our sugar detector. It's designed to go after glycogen, which is just stored glucose. And this is where it gets really interesting. Because lymphoblasts, the bad guys in lymphoid leukemias, they have this really unique, kind of weird way of storing their glycogen.
And this is the key takeaway, the absolute money shot. It's not just about whether the stain is positive or negative. With PAS, the pattern is everything. In kids with acute lymphoblastic leukemia, or ALL, The lymphoblasts don't just have a little bit of glycogen dust. Oh no, they hoard it in these big, chunky, magenta-colored blocks. Seeing that under the scope is a classic, textbook sign that points you straight toward a diagnosis of ALL.
So, let's put it all together. SBB and PAS are your dynamic duo for that first big divide. SBB is your go-to for myeloid cells, and PAS is your specialist for lymphoid cells. If your blasts are SBB positive and PAS negative, you're on the path to AML. But if you're SBB negative and show those classic PAS positive blocks, you're definitely heading down the ALL trail. This is that first critical fork in our diagnostic road.
Great, so we've made our first big call, myeloid or lymphoid. But now it's time to zoom in and get more specific. We've identified the right family, but now we need to pinpoint the exact culprit. And to do that, we need to call in the specialists, a new set of stains that will help us narrow it down even further.
Next up in our toolkit is the TDT stain. Now, TDT is an enzyme that's normally found in the nucleus of very, very primitive lymphocytes, the baby T cells and B cells that are still developing in the bone marrow and thymus. You can basically think of TDT as a newborn lymphocyte marker. And that's precisely what makes it so incredibly useful for diagnosing certain leukemias.
And here's the number that tells the whole story. Over 90%. That's right, more than 90% of childhood AAL cases will be positive for TDT. I mean, that is a staggering statistic. It's a real game changer. When you get a positive TDT stain, you are about as close to a confirmed ALL diagnosis as you can get. It's also super useful for keeping an eye on CML, because a positive result can signal that the disease is shifting into a more aggressive phase. Okay, now for a really clever one, the TRAP stain. That stands for Tartrate-Resistant acid phosphatase. Here's the genius behind it. See, most of our cells have an enzyme called acid phosphatase, and if you add a chemical called tartaric acid, it basically shuts that enzyme off. But the malignant cells in a very specific disease called hairy cell leukemia are different. Their version of the enzyme is resistant to the tartaric acid. It's this one tiny biochemical quirk, but it's a dead giveaway that the TRAP stain is designed to catch.
Now, here's the thing. While a positive TRAP stain is a huge clue, it's not quite a slam dunk. It is the primary marker for hairy cell leukemia, for sure. But you have to be aware that a small fraction of cases, maybe 5%, can be TRAP negative. And once in a while, other disorders might give you a false positive. So you should think of it as a very, very strong piece of evidence, but one that you'll want to confirm with other findings.
All right, let's switch gears and tackle a completely different kind of mystery. Sometimes the problem isn't telling one cancer from another. It's telling a cancer from an imposter, a condition that looks and acts just like cancer, but isn't. This is the classic clinical showdown, chronic myelogenous leukemia versus its tricky doppelganger, the leukemoid reaction.
So what is a leukemoid reaction? Imagine your body gets a really severe infection. It's going to sound the alarm, right? It needs to pump out a ton of white blood cells to fight it off. A leukemoid reaction is that response, but on steroids. The body goes into overdrive, releasing a massive army of white cells, including some younger forms. On a lab report, it can look identical to CML, but it's not cancer. It's just a really intense but appropriate physiological response. And our job is to tell them apart.
And here's how we unmask that imposter. We use a stain to calculate something called the Leukocyte alkaline phosphatase, or LAP score. This measures the activity of an enzyme inside mature neutrophils. And wow, look at the difference. In CML, the cancerous neutrophils are defective and lazy. Their LAP score is super low, usually below 15. But in a leukemoid reaction, those neutrophils are healthy, hard-working soldiers. Their LAP score is through the roof, way over 100. It's like comparing a couch potato to an Olympic athlete. The difference is just undeniable.
We have covered a lot of ground. We've journeyed through this incredible microscopic world, using these colorful chemical reactions to solve some really tough diagnostic puzzles. So now it's time to put it all together. Let's do a quick review of our complete diagnostic toolkit.
Here it is. This is your go-to guide, your cheat sheet for leukemia diagnosis. We've got SBB, our myeloid detector,
PAS, our lymphoid specialist with that classic blocky pattern, TDT, the ultimate AL confirmer, TRAP, our hunter for hairy cell leukemia, and finally, LAP, the tool that unmasks the CML imposter. Each one of these is a vital tool, and when you use them together, they give you the power to make confident, life-saving diagnoses.
And really, this is what it all comes down to. This is why all this matters. These stains, they aren't just pretty colors on a glass slide. They represent the critical difference between getting the right diagnosis and the wrong one. They're the very first step on a patient's long journey to getting better. The clarity they give us at this microscopic level has a massive, real-world impact, helping doctors make the absolute best treatment decisions for their patients.
So as we wrap up, here's something to think about. We're in an age of incredible technological advancement, with things like flow cytometry and advanced molecular diagnostics becoming more common. So, what does the future hold for these classic stains? Which of these elegant, powerful, and often simpler techniques will stand the test of time and remain essential tools for the next generation of lab scientists like you? It's a really interesting question to ponder. Thanks for joining us today.